Good morning to all participants from around the world. I welcome you to this webinar on the coronavirus and its impact on the higher education sector. My name is Alex Mejia. I am a Division Director at UNITAR, the United Nations Agency for Training and Research here in Geneva, Switzerland. And I take great privilege in being the moderator today. We have an impressive array of speakers that will be joining us, and I will be properly introducing all of them. But to put the coronavirus pandemic in context and to give them the floor to these speakers from very many countries, actually from the United Kingdom, from Switzerland, from the Republic of Korea, from Australia, Turkey, and the Philippines. And you will see that all of them have impressive resumes and positions of great responsibility. But I was saying, before we get to the honorable speakers that I just mentioned, and I will properly introduce, I wanted to share a presentation with you that perhaps will give us a general overview of how the coronavirus is affecting us so far, and perhaps the numbers, and then some issues of public policy and some ruminations that hopefully will help us with the proceedings. So, as you can see on the screen, in the world, there are 193 member states of the United Nations, but there are many other territories in addition to countries proper. And we have so far 212 countries and territories infected. There is very few member states of the United Nations or countries, sovereign countries, that are not affected so far. You see in this map of the coronavirus spread, infections, death, and recoveries. And you also see that we have those are the red dots. Then you also see that we have these green circles that mark the recovery, and the white circles that are the number of deaths. But here are the numbers, actually. And we wanted to compare what happened in 3 weeks or so, from 15 March to 8 April. We have an impressive growth of the pandemic and the number of cases infected by the coronavirus, and of course of people that have contracted the disease. The nomenclature, please don't go so fast. The nomenclature, go back, the nomenclature called COVID-19. And from 169 total confirmed cases on 15 March, we went to almost 1.5 million. Actually, at this moment, it should be more than 1.5 million. And look at 3 cases. China, of course, I won't mention because they have managed to maintain the numbers steady and to control this pandemic. But look at 3 numbers. The United States had only 3,700 cases 3 weeks ago, and now unfortunately leads the number of cases with more than 400,000 at this moment. Then Spain, it went from 7,000, 8,000 to 146,000, and Italy from 24 to 135. So you see that the coronavirus have literally wreaked havoc around the world, unfortunately, and with very many deaths. I mean, the numbers are cold. We go from 6,000 to 83,000 in 3 weeks, but the pain is real and is not distant. Very many families affected with these numbers. And then you also see the number of people that have recovered. Next, please. In the next slide, you will see how there is an exponential growth in the number of cumulative cases. You see the month of March, the whole month, and then just the part of April that have passed already. And there you see the escalation. But if you go to the right, you see that there are on the 8th of April, 68,000 cases, 68,700 cases as of yesterday. And it's something interesting to observe that there are several countries where the daily growth is slowing, especially in Europe, but we will get to that later. Next, please. In the next slide, you would see that we are using, thanks to our friends at the McKinsey consultancy company, a global giant when it comes to working with governments in consultancy and advice and so on, but also with the private sector. This company, McKinsey, that we greatly respect, organized a webinar also 2.5 weeks ago with UNDP, the UN Agency for Development. Our colleagues from UNDP graciously shared that presentation, and we decided to take some of the outlook, the scenarios that they have, because we believe them to be very relevant, but not before mentioning McKinsey's copyright and authorship. So they had proposed two possible future scenarios, one with a short recovery and another one with a prolonged recovery. Before that, you can see to the left a brief description of the situation now with more than 1,400,000 cases. And as I say, perhaps today more than 1.5 million cases, with concerns that a 15% hospitalization rate could overwhelm hospital systems. It has overwhelmed hospital systems already in some countries. As you all know, governments have moved to stricter social distancing measures with shelter-in-place orders in many areas of Europe, the United States, India, and very many other countries. This has driven rapid demand declines, and perhaps even though there are some attempts to bailouts and for government intervention, fiscal intervention, monetary intervention, and subsidies and the like, and international financial institutions as well, perhaps this is not enough because our economy for sure is suffering, and we will see some potential scenarios ahead. Next, please. So, before we get to these two scenarios from McKinsey, just look at the numbers from another perspective. COVID-19 has, and the coronavirus proper, has a higher reproduction than the flu. There are 17% of cases that require oxygen, so they are severe, and most of them end up in ICUs that are very limited in hospitals, no matter if you are in a developed or a developing country. 5% of cases, these are average numbers, of course, they change per country, but it's still very much relevant to see these averages. 5% of cases are critical, and these figures are considerably higher than what is typical observed in the flu. And then 4 to 5% crude mortality rate, as estimated by our colleagues from the World Health Organization. Just to compare, seasonal influenza is well below 0.1%, not 1%, but 0.1%. So the mortality rate is really aggressive with the coronavirus. To the right, you will see this comparison of viruses that have also had a very negative epidemiological impact and have created, in some cases, pandemics. Horizontally, you see the case fatality, and then vertically the reproduction numbers in terms of how one person, how many others get infected through that one person. Next, please. It's important to see this comparison with other diseases to understand these numbers that now you have on the screen. The total confirmed deaths due to COVID-19, it's still growing exponentially in some countries like the United States and the United Kingdom. And we do hope that those governments in their monitoring efforts reach a peak and then a flatter part of the curve, but that hasn't happened in those two countries. It is coming close to that, but it's too early to call. In Europe and in the most drastic cases of infection of this pandemic, namely Italy and Spain, but we are still not there. Next, please. We do hope that there is some seasonal decrease due to the change in temperatures in the Northern Hemisphere, but this is just a hypothesis. Very well. McKinsey created those two scenarios. We have adapted the names a little and tickle a little with their scenarios, but I again express our appreciation to them for coming up with these very well put diagnosis of the outlook. So in the short recovery, the virus continues to spread across the Americas mainly, Europe and Africa a little less, until mid of the second quarter. So we are talking about April, May, June in the second quarter, so perhaps mid-May. And then the seasonality that I mentioned, combined with the stronger public health responses, hopefully, and I emphasize the word hopefully, drives caseload reduction. You can see to the right the epidemiological scenario from McKinsey and also the WHO, where the US and European cases count growth rises rapidly through mid-April, which is happening as we speak. And this is something that McKinsey did with the WHO 2.5 weeks ago. Then test availability is indeed enhanced, but the extent of cases is fully discovered by late April only. And more aggressive shutdowns and social distances reduce the spread. So it works, but it takes time. Now, new case counts peak by the end of April and declines by June, only June, with stronger public health response and seasonality of the virus. Then only in the fall of 2020, we are better, but then perhaps we can see some small resurgence of the virus, although more countries have better public health preparedness and then the virus decreases again. In the Middle East, in Southeast and South Asia, and in Africa, they are spared the worst effects due to the warm climates and young demographics, especially the second, because young demographics with immune systems that are, work perhaps better than our in the previous generation, that has shown that even though young people can get infected and die, the percentage of contagion is lesser than what happened with older persons. Finally, China and East Asian countries continue in the current recovery and control the virus by the late second quarter. Next, please. We will see now how this epidemiological scenario is transformed into an economic scenario. What happened with the economic impact? China and East Asian countries start recovery, but supply chains remain impaired in much of the second quarter, and consumer spending is subdued. In the United States of America and in Europe, large-scale quarantines, travel restrictions, and social distances drive drop-off in consumer spending. Consumer spending is reduced, and subsequently business investment decreases throughout this year. You see layoff drive unemployment rates higher. That is happening as we speak. You see corporate bankruptcies spike, putting pressure on the banking and the financial system. Very, very dangerous. We don't expect the financial system as a whole to have a contagion, properly use of the word, but some of those financial institutions will need government intervention and support. Then you will also see that monetary easing has limited impact. This is when the government uses their instruments to inject money into their economies. And that happens because they have already low rates and fiscal responses have proved somehow insufficient and poorly timed. At the UN, of course, we remain greatly respectful of what our member states decide to do in their sovereign power and realm. So no punctualization here, just general comments on what we see in the economy around the world. Finally, we see self-reinforcing recession dynamics extend to extended GDP declines through the third quarter, and then global economic recovery only in the fourth quarter. This is the end of 2020. So perhaps a conclusion that McKinsey and UNDP reach is that the 2020 global GDP growth has indeed fallen sharply because of the coronavirus pandemic, driven by recessions in US and Europe and slower growth in China and other Asian countries. Let's go to the next slide. In this graph that you have in front of you, this says it all when it comes to economies in developed nations. This is what is happening in the stock markets, in the equity markets by country, and you have the indexes to the right, in India, in the US, in Brazil, in Germany, in China, in Japan, in the United Kingdom, in France, and in Russia. Equity markets have plunged in March. These are real numbers. This is not a forecast. And they have plunged As fear of recession drove investors to safe havens, most exchanges lost around 1/3 of their values. You see, because the horizontal timeline takes us from 2007 to 2020, you will see how the global recession of 2008 and 2009 is reflected in the drop in the equity markets by country. And then you saw the recovery, and now you see the sharp drop again to the extreme right. Next, please. Very well. We are talking about the short recovery, so it doesn't take that long to continue. Now let's talk to go back to normal, but now let's talk about the prolonged recovery. The virus spreads globally without a seasonal decline in this scenario, creating a demand shock that lasts until the second quarter of 2021. I am talking about the next year. Health systems are overwhelmed in very many countries, especially the poorest, with large-scale human and economic impact. The epidemiological scenario that you see to the right is that the US and European public health measures delivered initial containment of the virus only by early June, not by May. The virus does not prove to be seasonal, as very many people believe. And there is a mutation in the virus. There is a mutated virus resurging in the fall of 2020, which would be really a double one, somehow a double crisis on the health, on the public health perspective, but also on the economic recovery outlook. So this will be leading to a spike in cases across geographies throughout the second and third quarter, actually. Restrictions on travel and quarantines across the world are tightened further in an attempt to stem the tide. The US becomes the epicenter, which is already, while Southeast and South Asia and Africa are somehow spared the worst effects due to their warm climates and younger demographics again. In Europe, China, and East Asia, countries face a surge of reinfection as a result of attempt to restart economic activity. We see that yesterday, just yesterday, I was watching in the news last night, the city of Wuhan, where it all started several months back. Citizens were allowed to go up and about, back to their normal life and to their jobs and to roam the streets. And in doing so, China indeed is leading the way in telling us that it's imperative that we go back to normal in social life and in the economic productivity for countries. But we do hope, and they do hope, that there is no resurgence of the pandemic or recontagion, which is even worse in clinical cases because of mutation of the virus. Next, please. And remember, we're talking about the second scenario in which the recovery is prolonged. It takes longer. The previous scenario of McKinsey was the shorter version. So the economic impact of a prolonged recovery is that China and East Asia experience double-dip slowdowns as the economic recovery is derailed in 2020 and pushed into the first quarter of next year, 2021. The US and Europe experience demand-side reductions in consumer and business spending and deep recessions in 2020. Layoff and bankruptcies in the most affected sectors rise sharply throughout this year, 2020, feeding into a self-reinforcing downward spiral. Financial system distress is significant, but a full-scale banking crisis is averted due to better capitalization of banks. Indeed, this is very comforting to see after the situation that we had in 2008 and 2009. New macro-prudential supervision is indeed in place. Fiscal and monetary policy responses proved insufficient to break the headwinds in this second scenario. And the global economic impact is indeed severe, with significant GDP contraction in most major economies in 2020 and a slow-moving recovery beginning only in the second quarter of 2021. Next, please. In this prolonged recovery scenario, it's also important to remember how the education system proper, and now we get into the actual topic of the webinar today, and I must accelerate because my time is almost over. All of these things have had the social distancing measures and public policy as a whole have included school closures. you see the map. As of 8th of April, yesterday, all schools in about 85% of countries are closed, while all schools in about only 5% of countries are open. And there you see the map and the small dots. Next, please. The small dots of countries that are still that have still open schools. COVID-19 and the education system, socio-economic impacts. There is a disproportionate impact on girls. As you may know, 1.5 billion with a B students enrolled in schools or university are currently out of school. That's the translation of the previous map. This includes around half, 743 million girls. Over 111 million of these girls, imagine the number, 111 million of these girls live in least developed countries, where access to education is already a struggle in normal conditions, and information and communication technologies are indeed not available. The economic crisis caused by COVID-19 will drive families to consider the financial and opportunity cost of educating their daughters. Very sad indeed, but it happens. And there are lessons from the Ebola epidemic that we must observe. The closure of schools made girls vulnerable to physical and sexual abuse at home, transactional sex, pregnancies, as well as marrying off. Many did not return to continue their educations. Our colleagues at UNESCO monitor these numbers, and they can support these assumptions taken from the Ebola and now somehow model into the coronavirus pandemic. They have the numbers to prove these assumptions. Finally, global inequalities in access to education will widen, and progress towards the SDGs, Sustainable Development Goals, and particularly SDG 4, will be disrupted. Next, please. Now, in this overall presentation, it's important to see how the socioeconomic impact is linked to the economic cost, or correlated, of course. You see this map where the negative economic contractions through GDP loss, i.e. reduced output and productivity across the regions of the world, is actually expressed in numbers. And you see what happened in the US, what happened in the European Union, but also what happened in the Southern Hemisphere, and the numbers per region. Next, please. And by the way, I should mention that the World Bank is the source for this one. Next slide, please. Now, there are impacts on public expenditure to try to understand the socioeconomic impacts and the cost of mitigation. On the public expenditure, due to the GDP contractions, government's revenue will be severely affected, reducing the level of public spending on education systems in the long term. Education could become a victim of spending cuts, and money meant for education could be channeled elsewhere. Low-income countries will be the most vulnerable, as always. The cost of mitigation, depending on the existence of relevant infrastructure and level of preparedness for a crisis, use of distance learning systems may incur additional financial burden to the families and or education systems. Next, please. And now, just to wrap up on these public policies and lessons learned, we need more interagency coordination at the national level, and indeed harmonization at the regional and global levels. That must become a priority. I won't be reading these things on public policy. I will do it at the end. Perhaps I will mention them when I wrap up, because my time is up now. But let's go to the next, because I want you to see some very specific suggestions for the higher education system and universities. Also, let's go on. This is about resilience that must become a priority for states. Next, please, both nationally and locally here. Higher education resilience, actions for university to consider. To continue paying salaries of employees, to reduce economic and social inequalities in these difficult times, especially in developing nations. It will also limit the exposure of these employees to health risks. Second, tuition payments perhaps should be deferred until classes resume. If students have also paid for on-campus accommodation and meals, perhaps they should be refunded. All of these to ease the burden in the families of those students. Then perhaps peremptory and a good idea to create within a university a COVID-19 task force. You will hear that some of the universities that have speakers for this webinar already have done so, and the good lessons out of that. And finally, very controversial, some countries are considering an optional grade choice. That students could be given, could with a C, not should, that students could be given the opportunity for an optional grade choice which will indeed provide them with the option for a pass or fail grade, rather than a letter or percentage grade, which is the normal. This once in a lifetime change in academic policies will have perhaps the positive effect of mitigating the anxiety of students and families, given that their lives may have been disrupted by the crisis. And last but not least, next slide, we also have some suggestions for professors and lecturers. This is coming from the Brookings Institute. Of course, to embrace virtual learning, you will hear that in this webinar from the next speakers, to establish virtual office hours and to maintain contact with students and motivate them through those virtual video conferencing, and then perhaps to shorten assignments to provide the faculty, not only the students, some relief, but also the faculty, because we do have to remember that academic staff have their own personal challenges to face as they adjust to full-time online teaching. And with that, that's the end of the presentation. Let me go back now to you. If you can stop sharing the screen to our colleagues here at the UN in Geneva. Let me now give the floor to the first of our speakers, thanking you, of course, for listening to this short presentation. And do remember that there is a poll, we will have two, in which we are kindly asking you, our illustrious participants, how did you learn about this webinar, what sector you come from, and so on. Very good. Let me introduce the first speaker, a good friend of the United Nations, my personal friend, Emeritus Professor Dr. Mike Sachs from the University of Suffolk and very many other universities. Mike, it's quite an honor to have you with us, also in your dual capacity as a senior academician and a university administrator, but also as the head of the Institute for Corporate Responsibility in London. I give you the floor now. Professor Mike Sachs will share his presentation now. Mike, go ahead, please.
Thank you very much, Alex. The slides you were presenting are absolutely de rigueur in terms of the crisis that we face. If I could have my first slide, please. Is there a slide? Yeah, great. I wanted just to say, perhaps just to reinforce the point that I do, as Alex said, been around the block with several formal positions with universities, publications, research, and particularly to highlight that I've done a lot of work on regulation and health, which is very relevant to the current crisis, and have done a lot of international work, including with the United Nations as a senior advisor. But basically, I do want to start by looking at the bounding rules in the UK, because generally speaking, the government has got us all in lockdown. We've had tremendous problems here. We had almost 1,000 deaths yesterday, and we have our Prime Minister in intensive care, and it's like someone has sort of tossed a grenade into a room and everyone scatters and is trying to find a position of safety. And I think we are bound in higher education with some of these generic rules like hand washing, social distancing, not really going out except for exercise and other things, other essential tasks, and working from home where possible. But there have been some specific actions in relation to government. Government have said in relation to higher education that we should delay the annual research, well, if you like, the research audit that we have every 5 or 6 years in the UK, which brings considerable amounts of money to the sector, and also to impose a moratorium on unconditional offers by universities. This has been a really big issue in the UK because the government has thought that we give too many unconditional offers to bump up the numbers of students in our universities. But now what's happening is that instead of cooperating, some universities are competing with others by actually giving lots of unconditional offers in order to attract students to make up what they see as a potential shortfall in numbers related to the anticipated downturn of international students in the forthcoming year and perhaps years. There was a survey by QS, which does the basically the QS index, which looks at the world rankings of universities. They surveyed 11,000, some 11,000 international students, and 60% or more actually said they would be deferring any international travel and or they would be not going internationally in terms of their education in future. So this is a real worry for some universities. And basically, there are debates now in England about putting back in place the student number cap, because we have been able to recruit in universities as many students as we wish, as we can accommodate. But now, because of the competition which is breaking out, and because of the desire to protect some universities from the chill winds of coronavirus and the numbers of students they recruit, and the potential of students going to the wall, of universities going to the wall, there has been a desire to provide more regulation in the sector. And having said this, the Office for Students, as the oversight body, has given a lot of devolved responsibility at present to universities within this wider frame. Next slide, please, because I do want to talk about some of the local decisions that have been made. There's been some variation between universities, but most institutions have closed premises, including libraries and other accommodation, except for essential business functions like keeping the IT running, for example. They've moved to, as Alex was saying, they've moved to remote staff working, with most teaching online. They've deferred and extended assessments, including offering equivalents in terms of the studies that the students need to undertake, and encouraged, of course, flexible learning. And as Alex was saying again, have actually looked very sensitively at giving student accommodation refunds, using accommodation for alternative uses for disadvantaged people and so on, when the accommodation is within university hands. And it's been quite amazing that several thousand nurses, student nurses, for example, have volunteered to go on the front line of our National Health Service. And this is again where universities have responded to the call and some of the horrors, associated with this particular virus. And of course, it seems like small beer, but postponing graduation ceremonies to some future date because of the delays that are necessarily involved. But despite these initiatives, there are immediate dilemmas which still remain. So next slide, please. This is something that we need to be very mindful of, because professional regulatory bodies have had this big dilemma about how much flexibility do they allow in courses whilst meeting the standards for safe practice. This is really important. And indeed, some universities like Cardiff University have adopted a no detriment approach. So where students actually have achieved a certain level, they have put in place mechanisms to suggest that any further grade deterioration will not actually prejudice the students in terms of their outcome. But this is controversial because there are other knock-on consequences on some courses, particularly courses which have professional underwriting. But all these issues about, the NUS, the National Union of Students here, have raised whether or not there should be a fee rebate for students. Should universities also pay for childcare for those staff who have to take care of children with the school closures? Should people who are on 0 hours contracts have greater protection? And the IT issues, if people are working at home, are really great about, are people given equitable access to IT? Particularly in the developing world, when international students go home and then they have to undertake assignments such as exams. In Imperial College, for example, they have, it was reported a week ago that they were intending to roll out exams, handwritten exams, which could then be scanned in and returned within a set time frame. But of course, given the differential time zones across the world, it would mean that some students would actually be sitting these exams in their countries in the middle of the night And these kinds of things are not something which immediately comes into vision. There's a lot of sort of, working by the seat of the pants, as it were, in terms of adjusting to new issues which emerge out of the woodwork as we move forward. But the silver lining is that I do think that following the coronavirus, there will be more changed work practices, often for the better. I know that students often want more online learning, but some lecturers haven't been very receptive to this. But now they've been forced to do more online learning, and this has proved to be quite pleasurable but stressful for the staff. But it is moving the whole agenda forward in higher education, as indeed is, sharing best practice, moving towards a global curriculum in the light of the global dimensions of the crisis, and indeed offering opportunities for rationalizing higher education, more collaboration. And these opportunities need to be taken. Next slide, please. Basically, higher education is a key enabler of change for the United Nations Sustainable Development Goals. And it is very encouraging that most universities now are actually matching up their practice against the SDGs. And these are very, very important. And I'm sure that most people will know what the 17 SDGs are. But I mean, they do range from, providing for more healthy living, providing quality education, whether it's in the developed or the developing world, moving partnerships forward, making sure that inequalities are diminished, and indeed, as Alex has been saying, trying to reboot the economy in face of this crisis and get economic growth. So next slide, please. These are things that universities make a major play in actually moving forward. And we do need to ensure that higher education is actually not disrupted because of its critical role. And I would like to draw attention to the importance of universities in sustainability. I mean, there is the upfront issue of lab research for vaccines and tests for COVID-19. There is the issue about increasing environmental sensitivity with courses, about addressing the disadvantaged. And we've seen a lot of charitable work going on from university students who volunteer to help the vulnerable in these difficult times. And also, there has been a lot of emphasis in universities on the green agenda. We don't want to see any of that stopping as we move forward. And basically, I would say that the coronavirus outbreak requires responsible leadership at all levels. This will include risk mitigation, empowered decision-making, partnerships, which I've mentioned, creativity. It's very important that we are fleet of foot in terms of what we do and pragmatic. We're resilient, we're resource aware, so we need to work within the resources that are available, and we adopt a holistic perspective, not just seeing our silo-based position, but actually seeing 360 degrees some of the issues that people are facing in higher education in this crisis. And we should be looking not just over the short term, but over the medium to long term too. This is really important. And so, final slide, please. That will be really great. Because what I want to do is to put a plug in for the UN-sponsored and endorsed Institute for Responsible Leadership, which is working in partnership with UNITAR, and basically is a not-for-profit body that promotes responsible leadership, as I've described, in the public interest. And this applies in, higher education systems, but also more broadly, and involves the offer of courses, seminars, membership, fellowship, accreditation, mentoring, coaching, and research. And in fact, we are planning a session in the not too distant future on the coronavirus and also the implications of this for responsible leadership, not just in higher education, but more broadly. If you do have an interest, then please do see our website, which is on screen, and also do feel free to contact the coordinator and convener of the IRL, Julie Search-Whitaker. That's it. So thank you very much for listening.
Yes, indeed. Thank you very much, Professor Sachs, for giving us the views from the United Kingdom and indeed the importance of responsible leadership at this time. Now, I need to do what moderators normally do. I'm the time police, and I need to kindly ask the speakers to somehow adapt the very important presentations and messages to 10 minutes. But without further ado, we are going to invite Professor Carlo Federico Catani, a good friend of the UN, of UNITAR, and myself, based in Switzerland. He's a professor of finance, trade and development at International University in Geneva, to give us the view of what is happening in Switzerland indeed, but also in France and Italy. Dear Carlo, the floor is yours.
Thank you. Thank you very much. Can you hear me?
Yes, indeed. Go ahead.
Good. My presentation will be not in depth, but really a kind of response of what I hear from directly and from, I have two kids at university at this very moment. So I also know their problems directly. Can you put on my first slide?
It's on. We are looking at it. Yeah, the COVID influence on the higher education sector and perception in Switzerland.
Okay, that's okay. Then the next one, please.
The
Okay.
EPFL link.
Okay. First of all, as I mentioned, I wanted to talk a little bit about Switzerland, in which you have different scenarios, a different type of universities, as you know. Some of them have taken a very serious step. Let me put on, if I can, this EPFL, the Polytechnique Fédérale de Lausanne. Can you click on this, Sebastian? Is it possible to go on the site, or shall I do it here? Would it work? No.
Sebastian is trying, but carry on.
Oh, okay. The reason I wanted to go on the website of EPFL, but if it doesn't work, it's not important at all, is to show you that the EPFL has taken a very clear situation, very clear vision of what to do, what not to do at present, and has informed both teachers, students, and everybody working in that organization to know exactly what they can do, what they cannot do. Of course, access to the university is closed. Everything is done at a distance. But since there is a campus with students, the campus will continue to work. They have to be confined, but they will be fed. They will continue to be able to work in a normal. This is the other slides. This is a different slide. Can we have the EPFL? Otherwise we stay on this one if the link doesn't work. In any case, going on the link, it will show you how clearly steps have been taken by EPFL for every party involved with no uncertain areas. They know what they have to do. They will resume, of course, exam. They will study at the distance. All the features are there for I would say a smooth running in this period of confinement. Now, if we go on the next slide, the one which gives you, can you give us, Sebastian, on the next one? Yes, that is the other. I have another child who is at the École supérieure de commerce de Paris. It is divided in two parts, one in Torino, Italy, and one in Paris. So the first 6 months in Torino, Italy, and the second. The reason why I mentioned this one is that the information provided by the university are, as you see, summarized in these pages and full stop. So my son doesn't know what he has to do now on the second part of his master, where he's supposed to go to Paris, where he had booked a flat to be in Paris, and there is no knowledge of how is it going to happen. The previous speaker was very clear in mentioning the points that the university in England are studying, whether it should give a refund, a fee rebate, or anything like this. In the case of this one in Paris, there is no information whatsoever. The trimester should start now in April. It has started, but they don't know. Of course, he's here confined in Geneva. So very little information. So one of the problem is the difference between universities in the degree of information provided to students and of course to parents that have to pay for the tuition. No question whether, so we don't know, for example, in the case of my son, whether to suggest to postpone the term in Paris to whenever it will take place. The reason reason I mentioned this one is because it is a specific master in food and beverage, where food and beverage management, where a lot of the interest of this university was in visiting companies and places where food is provided, food is served, food is prepared, and large companies, small companies. All this in the second part, the one in Paris, is no longer possible. You cannot do a distance meeting with the producers and with large companies. So that raises a number of issues that have not been addressed. Okay, there is a help desk, but that's not really very helpful for the moment because it doesn't answer. Okay, next slide, please. Okay, this is what happens in Italy. The Bocconi is one of the largest institutions at the Bocconi. Okay, suspension of physical lessons. Faculty members are asked not to go to work, collect material, and then everything is closed. The campus will be closed. And so teaching activity will continue remotely, and exam session will also be held remotely. At least so far, students know what they have to do. They have to stay at home. They will have lessons. There will be sessions for the exams. So everything seems to be at least programmed. We have decided to postpone the deadline of the third installment for the degree program tuition and fees. So at least there is a small indication of what happens with the fees, which was not in the case of the Paris institution. Next slide. Okay, now we move to a more international scene, and it's really what happens on the fact that a number of universities, the 10 largest universities, are really counting on Chinese students. Chinese students average about 1 million students, of which 300,000 are in the States, 130 in Australia, and almost 100,000 in England. When I was in Boston at Harvard last year to visit my son, and the campus is really more Chinese, more people from that area than from anything else. You don't have the impression to be in US. So that's a number of students. Now, what happens to these students? The students went back home and now cannot go back to the universities. And so this is affecting a lot these large universities. The economic damage, I don't know whether this will be confirmed later on by our friend speaker. The economic damage is in billions, 5 billion euros estimated for Australia only. 5 billion euros. Okay, can we move to the next slide, please? Sebastian?
We are looking at the next one.
Yes, I see it now. There is a time lag, and here it is.
Thank you, Carl.
Financial impact of the pandemic. Okay, we're back to really on the students. My impression is maybe in England it's different, but in many places students are not really put in a condition to know exactly what to expect. And this is due to the fact that the coronavirus spread so quickly that the university was caught by surprises, and they have not immediately reacted in reorganizing the life of the present student. The financial impact on the students is, of course, is that they don't know whether to pay, not to pay. Will they be able to sustain the next round of studies? Will they be able to do some side works when they're going, let's say in England or elsewhere, they could do some little works to earn some money on the side. Now, staying at home, of course, you cannot do that. The second impact is, of course, on universities. We have seen the $1 billion lost in Australia, but everywhere, I think it's a huge amount. And I'm not convinced university will be able to recover that money by distance learning and by other activities. They will have really to find ways and means to provide, to offer something that it is equally valuable. And for the moment, that is not there. The third impact, which I see, is also on very simple things like campuses and lodging. Students that have booked the lodging for the semester, for the studies, don't know whether they can pay. They will have to pay or not pay. Whether somebody will compensate for payments that they are probably by contract obliged to do. And so this is the third aspect that I think will have to be taken into account. Next slides, or is this my last one?
Yes, I think we have concluded and the time is also over. Thank you, Carlo.
Fantastico. Okay, thank you.
All right. Thank you so much, Carlo. Professor Carlo Federico Catani, speaking from Geneva in Switzerland, giving us an overview of what is happening indeed as a parent and also as a faculty member in these three countries, France, Switzerland, and Italy. Now we will move to the Republic of Korea. It's quite an honor to have with us a very senior diplomat, Ambassador Kyung-Hoon Sul, who's the director of CFAL Jeju, the United Nations Training Center in the Republic of Korea, and also a United Nations Senior Fellow. Ambassador Sul will give us a more general perspective of a very interesting one of the Republic of Korea. As you will remember, both China and Korea suffered the initial impacts of this pandemic, and the Republic of Korea was impressed on its recovery. So without further ado, I will give the floor now to His Excellency Ambassador Sul. Can you hear me, Ambassador?
Yeah, do you hear me?
Yes, yes, of course. Now we hear you.
Okay. And as introduced, I'm heading the UNITAR CFAL Jeju, located in Korea. And my institution provides capacity building programs for the Asia Pacific countries in an effort to help them to enhance their capacity to achieve sustainable development goals. But with the coronavirus outbreak, we had to suspend all of our activities scheduled up to May. And if you think about the global situation, and if we think about the two possible scenarios, I'm afraid that we may have to prolong this suspension for the period beyond June as well. Can you move to the next slide, please? Let me start with the current situation of coronavirus infection in Korea. As of today, a total of over 10,000 cases have been confirmed as coronavirus infection. To be exact, as of today, the number was 10,423 cases. As you can see in the red circle in the chart, there was a sudden upsurge in infection for the couple of week period in February and March, bringing up the number of infections from a few hundred to more than 7,000 or 8,000. This was mainly caused by the cluster infections. In other words, mass infection occurred to certain groups of people because they were involved in some activities together, or they were in the same spaces, usually closed ones, like the same working places, churches, or hospitals, and so on. Out of the total infection cases, about 6,700 patients have been cured and discharged from the hospital. Still around 3,400 patients remain hospitalized. So far, over 200 people have died of the coronavirus infection. Of course, tens of thousands of people with COVID-19 symptoms are still under self-isolation at home or at state-designated locations. At least, if you look at the chart, good news is that recent statistics show a decreasing number of new infections. At the moment, our daily increase seems stalled around 50 patients. It is not clear yet whether we can say we now have entered into the stabilized situation. The pattern of infection has also changed. Now about 50% of new infections come from abroad. Daily arrivals from abroad still range from 5,000 to 8,000 people. This has led to a little bit stricter regulation from the government for incoming travelers. Can you move to the next slide, please? Regarding the educational sector, obviously the onslaught of the coronavirus 19 has incurred devastating impacts in almost every sector of our life. Education sector is one of them, of course. Overall, it is becoming clear that our educational system has not been that well prepared for this kind of emergencies. This means, while we are taking measures to respond to the disaster emergency cases, there will be a lot of trials and errors inevitably incurring unnecessary social and economic costs. Let me talk about a little bit more about the Korean government's reaction or countermeasures. Korean governments take some of the very concrete measures for the educational institutions. For higher educational institutions, like universities and colleges, the school year has started in mid-March with a couple of weeks delayed. That means, the school is open, but all the classes at the moment are being conducted by distance learning, mostly through online. Additionally, education authorities are advising universities to exercise greater flexibility in administering the academic requirements. For instance, school can introduce more flexible credit systems like a credit concentration, credit transfer, or credit exchange programs. I will provide some more detail in the next slide. But before I do that, can you move back to the previous, yes. As for the international students, if you look at the third column of the tertiary education, it introduced a special support and monitoring system for international students. As for the international students, the Education Ministry introduced a special monitoring and support system. We have about the 160,000 international students, and among them, Chinese students account for about 45% of the international students. While there will be no restriction for them to enter into the country,
controls are being put on at the state level, and that's creating a little bit of an issue or some tension for us. But I thought I'd put the student participation at university into context. There's approximately 565,000 students from international origins in Australia, including about 335,000 in the higher education university sector. And if you put that into the perspective of a population of 25 million people, that's essentially 1 in 50 people in this country are an international visitor doing some form of education. And so it's something that we really need to be aware of and careful of. There's a contribution of about 39 billion a year from international students to the national economy. It's the third largest export after iron ore and coal. And with our own students, there's about 1.2 million domestic students in universities of Australia. And there's a bit of a struggle going on now because we have quite a different school year than you do in Europe. We're just actually starting into our school season in March. And there's a big concern about our students who are in their final year of high school this year, and will they get the credentialing and the credits and the scores they need to get accepted into a university. So universities really have to start looking at what are we going to do for admissions criteria for our students next year. Next slide, please. The sector itself has responded very quickly, each university really doing its own thing, but along a lot of common themes. For example, as everybody's been talking about, really flipping to an online offering very quickly. You know, March the 1st was really the start of our term, which was when this thing really started to hit hard. And so we quickly went to an online lectures and tutorials, trying to get student engagement online, which is a very interesting thing. Is one thing giving information, giving lectures, but it's that continued engagement that students need with each other and with academics that is hard to do. And there is some concerns across a number of the universities around the IT capacity, both locally and globally for our international students. And we have at Newcastle around 7,000 international students on our campus. We virtually have about 5,500 of those here, and there was only about 1,500 that got stuck when the travel bans were put on around the 1st of March. We've also created some flexible terms, so we've added additional teaching time. We've extended our first term from 12 weeks to about 17 weeks to give students a little more time for studying online, because they're all telling us they find it very difficult to study online. It's hard to keep up with the amount of coursework. And we're looking at how we can delay examinations or change examination formats. And like many countries, there is some discussion around pass or fail marks, which I think are relatively straightforward, but they do create issues with competition around scholarships for PhDs and these other issues. We've also got quite an issue going on with research, of course, because we've got a number of our international higher degree research students, PhD students, that can't come into the country. Australia depends heavily, almost 50% of PhD students in the country are international, so we depend heavily on the workforce coming internationally to solve some of our research problems. And so there is some issues around grant deliverables. Can we actually deliver when we think we can on time? And we've also put in place, each university, some very extensive business continuity plans to try to look at how do we keep our labs open, our labs moving forward. Field research is pretty well finished for I think for the next 5 to 6 months in the foreseeable future. So there's lots of issues we have around ethics approvals, animal ethics approvals. How do we deal with all of our laboratories with specimens and fridges and freezers? And so there's quite a bit of work going on around that. Next slide, please. We also really are trying to put in place some student support. We're finding student hardship is really starting to spiral and escalate. And this is just students basically not being able to go and buy food, to pay for their lodging. There are some subsidies available through the government for lodging, but many of our students also work part-time. And of course, their jobs were one of the first series of jobs to go as unemployment rates are starting to really skyrocket in Australia. So it's becoming very tough for the students to get additional money. So most universities have created some form of hardship fund, both through either direct contribution from university budgets or through raising money through philanthropy. We've had some suspension of student placements. So these are students in degrees where placement is critical. So in the medical profession, it's not such an issue because they want our students to come and work in the healthcare profession. But there's been basically most of the other student placements that are required for degree completion have been suspended. We've got some issues around our residences. There's an uncertainty whether the government will allow them to stay open because of the close proximity of students. They are open at this point in time, but they may close, which means students have to look for additional housing, which is becoming tight. And we're all concerned about the pipeline for recruitment, particularly for the international students in the future. Australia, as somebody pointed out earlier, is very highly, it's a great location to come and study. And so we do have a large percentage of international students. The next slide, please. We've had to put a wide range of contingencies in place to keep the institutions functioning. Most of the universities are still open for business at this point in time, but under a very different business model. There's a restriction on basically face-to-face teaching, except for small classrooms, and the government has mandated a 4 square meter patch of classroom per student. So the students are spread out if we do have live students in classrooms or in laboratories. We're working to ensure as many of our lectures and tutorials are online. And we've actually gone around and physically measured every facility we have and put a capacity sign on it saying, you know, no more than 6 people in this room or no more than 12 in that room. We're really looking at whether we can continue with labs and laboratory sessions and sort of practical classrooms for now. So we're trying to think of how we can do that online. And we're continually adjusting the academic calendar as we get, you know, I guess different messages from the government on a weekly basis as to what things will be implemented. And so it's a question of being flexible. We've put off our graduation ceremonies, and we're still really trying to look at what everybody else is doing with exams and assessments and how we'll roll that out towards the end of our first semester, which will end somewhere around the middle of June this year. Next slide. I thought I'd spend a little bit of time just talking about what universities are actually doing to help people within this crisis. And in Australia, we've actually had a really bad year. We've gone from very significant droughts to about 3 months of bushfires and now directly into this COVID. So we're actually getting pretty good at reaching out into the community and asking what the community needs to help get through these multiple crises that we seem to be experiencing at one time. And so next slide, please. So some of the things that we've been doing really for the last couple of months is quite a bit of community outreach into particularly the regional parts of Australia, small town Australia, into the Indigenous communities. There's a lot of issues around mental health as people are losing their jobs, their homes, they're uncertain about what the future is, they're scared about the coronavirus. We've enlisted a lot of our student health workers into the workforce. So our nurses and doctors and students are all basically been enlisted into the workforce. We're using our student residences, or we've offered our student residences to be used in case there's an overflow in our hospital system. My particular city, Newcastle, is a region of around 1 million people. So it's a fairly large population, but luckily we were under a couple of hundred cases right now in Newcastle, and we've created the hardship funds. The other things that have been a lot of fun, I guess, is really looking at how can we make practical solutions to things like hand sanitizer. So we're actually producing ethanol. We've got some great mixtures going on. There's different groups competing to make the best sort of antibacterials, which are in very low supply in Australia. Our engineers are working on providing easy to build and cheap respirator technologies, working with our local manufacturing industries. We're really trying to look at how can we help enlist the online learning platforms for our students that are in high school and primary school education, because this is a real big challenge for them. The public schools have been closed down, so that parents are basically having to teach their children themselves, and we're trying to look at how can we use some of the technology we've developed in our education schools developed in trying to drive some of the outcomes in education. And there's also been some work around producing masks and for healthcare workers using 3D printing. So I think most of us at universities are all doing this, but I think it is an important thing to recognize. It's really critical that not only do we to look after ourselves, we need to be looking after the community. The next slide. I thought I'd just end off on looking at our what we're doing around our marginalized communities. We do have a lot of remote rural communities, typically with a low socioeconomic status, and we have a lot of Indigenous communities. And we have basically 68% of our kids between 5 to 14 in our disadvantaged communities having access to the internet. So online learning isn't possible for them. A lot of the rural and remote regions are not on any poles and wires, and so they either have a satellite internet or they have no internet at all. So this becomes a really big challenge for remote learning. The other piece is, you know, the unemployment during COVID-19 really affects people who are working in things like the hospitality industry, and we've had lots of closures. So there's quite a bit of economic hardship going on in communities which are already marginalized. Growth forecasts for Australia are looking at unemployment rates of around 17% in June this quarter. and maybe settling around 9% by the end of the year. And that's in a country that's had a historical unemployment rate of around 1.5%. And the last slide, please. I'll just finish up on the last slide again. One of the big issues is also the vulnerable populations with our Aboriginal and Torres Strait Islander groups. And these are often people that also have other chronic health conditions and elderly populations. And of course, COVID-19 has a lot of comorbidity and with some of these chronic health conditions. And the other thing is really how do we, as a society, and how do we as universities help our society connect to give access to education and healthcare in these marginalized communities. So I'll end on that note. Alex, thank you.
Thank you very much, Professor Hall, for giving us this view of what is happening in Australia as a whole, but also particularly in the higher education sector and your university, the University of Newcastle. Very many ideas to debate and discuss, and I sincerely appreciate that you are giving us this time. Now we will move to the case of Turkey, and I would like to invite Professor Ahmed Aydemir, Professor of Business Administration at Bahçe Heshid University, a great ally of UNITAR as well as the previous case in the University of Newcastle. In this case, Professor Aydemir, based in Istanbul, will give us the views of what happened with universities in Turkey. Professor Aydemir, the floor is yours.
Thank you, Mr. Mayhem. I would like to first of all salute all our guests, esteemed panelists and respected members of UNITAR from Istanbul, Turkey, and hope that within this difficult and challenging times, you are safe and in good health with your loved ones. As Mr. Mayhem mentioned, I'm a professor of business administration at Bahçeşehir University and the director of the UNITAR affiliated International Training Center for Authorities and Leaders, CIFAL Istanbul. As our panelists mentioned, the advent of the novel coronavirus has affected all aspects of life in a short time. And one of the sectors that was heavily influenced by COVID-19 was the education sector. When you can see the numbers on the slide, according to UNESCO statistics, more than 90% of the students enrolled in education, meaning almost 1.6 billion learners, have been affected by the coronavirus pandemic, with 188 countrywide school closures, which are worrying numbers. Each country, of course, was affected in various ways concerning education, and of course, that includes Turkey. Can we move to the next slide, please? Yes. Concerning countrywide response to the pandemic, I can honestly say that Turkey took the necessary precautions and acted proactively. One day after the first case was discovered, Turkey put all schools and universities on hold and shut down all public gatherings. 2 days after, public transportation was severely restrained throughout the whole country. And we used this time to prepare our institutions and schools. And after a week of nationwide preparation, all educational institutions were reopened digitally and started providing distance education services. This means that through online methods and broadcasting, 18 million school and 8 million university students continued their education with only a 1 week delay. So if you look at the numbers, we have almost 26 million students, which is as much as the population of Australia, as Professor Hall mentioned. This was possible thanks to the efforts of the government, especially the Ministries of Health and Education, and of course, over 1 million teachers and 150,000 academics. Next slide, please. Within this educational outlook, BAU Global, where I work for, was one of the first and promptest institutions to shift to digital education. This is because under the responsible leadership of its founder and chair, Mr. Enver Yücel, who sends his regards, BAU Global had been investing in distance education and providing online classes since the last decade. As of March 2020, all institutions under its network, which includes 6 universities and nearly 300 schools in 6 countries, were fully digitalized in providing education. Since then, almost 200,000 students from 196 countries have been receiving seamless online education. Next slide, please. The major institution and managerial foundations behind these numbers entail 3 things: dedicated global educational response to the pandemic, institution-wide collective efforts, and continuous investment in educational technologies and very importantly, teacher training, which Ambassador Su also mentioned as well. To battle the effects of the pandemic on education, first of all, a dedicated task force was established, and this managerial team of experts developed a thorough response protocol. The principles that would guide the implementation of the institution-wide strategy were clearly defined. 1, protecting the health of students and staff. 2, ensuring academic learning. And 3, providing social and emotional support to students and faculty. These principles were established in close relationship with the Ministries of Health and Education and the Higher Education Council of Turkey. So it's important to be in communication with the local authorities in defining these principles as well. Open and frequent communications were initiated with all members of the education ecosystem, which means students, teachers, academics, and parents through accessible digital channels. And we had to revise learning outcomes and curricula based on distance education principles and the time that we had left in terms of quarantine. With the support of our autonomous and dedicated distance education center, thousands of teachers and academics were trained on digital technology usage, virtual class design, and content delivery. These trainings were updated, conducted almost daily to foster and initiate continuous professional development. Obviously, I need to mention that through all of these efforts, it was only possible by the diligent and collective effort of all members of the institution. I also believe that though providing the theoretical background and technological infrastructure to foster digital education are necessary, by themselves, they're not enough and they're only hygiene factors. The vital aspect of the pandemic action plan was actually the provision of adequate social and psychological support to the education ecosystem during the implementation. Within this framework, guidance was provided to students and academics to preserve the well-being and health of students, parents, and educational staff. Next slide, please. During this outbreak, in all responses, we tried to adhere to the United Nations Sustainable Development Agenda 2030 and the SDGs in order to deliver accessible, inclusive, and quality education, provide good health and decent working conditions to all our members. By that, I mean the families, the students, our faculty members, administrative staff, everyone. Mr. Meha talked about a short-term and long-term prediction for the virus, but if we look at the current and future implications of the pandemic, we can be mindful of the fact that this struggle is not a sprint, but a marathon. So, and to overcome this, during the long run, we must pace ourselves and prioritize good health over all else, because everything can be replaced or compensated for, except for our well-being. Within the first step of this, it might be of benefit to realize that this period is neither a holiday nor a retreat. It's a mandatory quarantine ensuing a pandemic that the majority of the world have never witnessed like the likes of before. And even though this period is temporary, we know that it's going to pass. It may not feel that way yet, as we are living through it right now. And the current loss of the sense of normalcy, certainty, and safety may result in collective grief on micro and macro levels. It is thus normal and humane if you're feeling anxious, grief, fearful, or even frustrated with the world, with yourselves, with others. It is also normal to be in disarray or even be temporarily unproductive, as nobody's ideal working condition is a distressing pandemic. To overcome this, I believe that it would be beneficial to accept that this is an extreme period and it may take a while before we return to our normal lives. So during this harrowing time, we must take care of our health and safety. We must be patient with and understanding towards ourselves and practice self-compassion. We must be mindful of and empathetic towards our family and friends, and we must prioritize health and well-being for ourselves, our families, colleagues, and also students. Above all, we must always be hopeful and remember that together we can and we will persevere. On a related yet minor note, I agree with the World Health Organization and believe that when we refer to the isolation measures that we take to fight the coronavirus, we must use the term physical distancing rather than social distancing. This is because as humanity, we can only get through this pandemic by physically distancing ourselves from each other, but continuing our social solidarity. At this point, it is heartwarming and encouraging to see that the societies of the world, regardless of their race, nation, or beliefs, have come together in solidarity to fight this pandemic. However, we still have a way to go until the battle is over. Furthermore, when we overcome this pandemic, there will still be the problems of poverty, inequality, injustice, war, and climate change to deal with. It is my hope and wish that humanity continues to show resilience and solidarity, just as it is doing right now against the coronavirus pandemic, and solve these global problems before it's too late. I thank all of you for listening, thank the UNITAR team for organizing this event, and hope that with each coming day, the world becomes a better and healthier place. Thank you.
Thank you very much, Professor Aydemir, for giving us the views on the university system in Turkey, and particularly your prestigious university, BAU, with that impressive number of students and institutions under its wing. So we will move from Turkey to the last speaker, but not the least, definitely from the Philippines, Professor Edna Ko, a great friend also of the UN and UNITAR particularly. She's a professor of public administration at the University of the Philippines, and also a long career, very experienced administrator that has a holistic view. I give the floor now to Professor Edna Ko from the Philippines. Edna, can you hear us?
Yeah. Thank you very much, Alex. And I'd like to thank also the organizers, UNITAR and the CFAL Global Network for this webinar. I'd like to begin by saying that the Philippines is very much an educational system where there is a strong face-to-face learning approach. But we were almost caught flat-footed in the onslaught of the coronavirus. And this puts us really into a tremendous challenge of moving into more distant learning, more remote learning. But I think I have confidence that we're riding over the tide and we are ready for the challenge. But as an overview, first of all, may I allow the participants to look at the map of the Philippines right now. The Luzon, which is at the very northern part, the biggest island in north of the whole country, is the one that is badly hit and badly on a lockdown. We're now on the 4th week of a lockdown, and the President of the Philippines had decided to extend the lockdown until the end of April at least. We have, as of yesterday, the other day, actually as of today, our confirmed cases are already running up to 3,800 plus. And the deaths are 188 as of today. And the recoveries are 84, and still the recovery is going up. That's on the total population of the country of 109,238,509. So if you will compare it with the other countries which are undergoing the pandemic, our numbers might be small because we might have come late in terms of this. One view on this, that because of the nature of the country, which is an island, probably the creeping of the pandemic has been slow to take, but right now it's going on speed day after day. So under the lock-up, can I have the next slide, please? Yeah, we have here the impact of the COVID-19 on the universities in the Philippines. I'd like to thank, by the way, the Commission on Higher Education for providing some of the information here on the overall data for the country. We have here overall, all over the country, state universities and colleges, there are only 111. If you count the satellite campuses, there are 541. And as you can see on the screen, you have also local colleges and universities run by the local government. There are just a few of them, 118. Other government schools, but take note that our private higher education institution is overwhelmingly large. And later on in my presentation, I'll show you that this is actually a big challenge. We have a big number of private higher education, 1,721 all over the country. And my university, University of the Philippines, is the only national university which has 8 constituent universities, 1 autonomous college, and 7 campuses. Next slide, please. Now, can I move to the next slide? All right. Now, upon the lockdown, which was March 9, 2020, the immediate response of the higher education institution is to, being at the helm of the National Higher Education Institution, it issued immediately 2 memorandum circulars and 5 advisory issuances, which effectively cover the following. One is the suspension, the immediate suspension of classes in Metropolitan Manila. Metropolitan Manila, which is the national capital region, has the biggest number of population in the country. It's actually, it has 15% of the national population, but also it has the biggest concentration of higher education institution. And the other issuance and circular by the Commission on Higher Education immediately also suggested and recommended that there would be screening, prevention, and control of people, of students, including the issuance of a limited travel. And this puts everything hold, actually. The immediate setting up of the higher education institution clinic for triage and for information campaign regarding the COVID-19, setting up contact points to provide students with information, health experts, and to for everyone to observe social distancing everywhere at all. Next slide, please. Next slide. Among the other issuances of the Commission on Higher Education were also the declaration of state universities and colleges to serve as quarantine facilities. So the enhanced community quarantine, immediately schools, higher education institutions were converted to serve as quarantine facilities to accommodate not only students, but also communities in the vicinity communities. The deployment of swift measures to address the needs of students, of faculty, employees, and stakeholders, suspension of mass gatherings and big events, including, for example, sports activities, and so on. And the deployment of available remote learning in lieu of residential learning. I'll speak in more detail about the deployment of the remote learning in lieu of the residential learning later on. And quite recently, there is the issuance and solicitation of proposed 2 state universities and colleges to seek grant assistance from the Commission on Higher Education. Now, what has happened to individual universities and colleges? These are issues which were immediately enforced and led by the Commission on Higher Education, and every state universities and colleges, as well as private higher institutions, abide by the issuance and the memorandum circulars. Next slide, please. Now, what happened to the universities? What were the action taken? In my universities, for example, we had all different colleges in the campus. There are 27 colleges in one campus alone who took up some community and services immediately, not just to the students and academic population alone, but also to the community around the universities. These were done based on expertise. I will not read each and every one of this. Let me just cite an example. When I say that the actions taken by the university was on the basis of the area of expertise, we have, for example, the creation of a committee on community affairs, the Office of the Vice Chancellor for Community Affairs, who took charge of students who were locked down inside the campus dormitories during the lockdown period. And because of that, the students themselves were engaged in producing face shield frames for frontline health workers to use. On commercial level, the mask and the face shield frames already ran out because of large demand. And because of this, university students who were inside the dormitories started to produce on their own voluntarily face shield frames that are given to frontline health workers. Immediately also, there was a creation of the COVID-19 task force, and the task force was on top of the whole station within the university, which included adjustment of the academic syllabi with the remote modes of learning. And even as we speak, there are these committees which are almost day and night working on how to immediately switch to remote learning, having come from a very heavily face-to-face learning tradition. This is a real challenge for leadership in the universities. Then we have ongoing, very regular, very weekly Zoom meetings among leaders and committees of the university, not just among faculty, but also among staff, the employees, and meeting up with our respective units. The College of Engineering, Department of Metallurgical and Material Engineering immediately assisted the whole campus in providing disinfectants to clean up buildings, emergency rooms, hospital walls which are inside the community, and all office equipment throughout the entire campus. Next slide, please. Can we move to the next slide? Yes. The College of Science lent out our PCR. This is the chain reaction. It's a technology to be able, a machine to be able to use and facilitate testing centers. And for example, in the College of Arts and Letters, Filipino Language Department, they immediately translated in the local language the issues and the facts regarding COVID-19 to propagate better education, especially in various communities and in all offices. And then in the case of the home economics, the College of Home Economics, the Department of Clothing and Textile Industry, they helped them immediately produce the PPE for healthcare workers. This is the personal protective equipment useful for healthcare workers. And our psychology department, the College of Social Sciences, mobilized a whole mass of PsychServe volunteers to provide psychotherapy services, to provide mental health care to those who were gravely distressed, not only because of the lockdown, but also because of the great adjustment of the academic work from face-to-face to remote learning. And so we had to hold hands, in a matter of speaking, with the university taking a big role and putting themselves at the center of community action. The scientists were quite helpful in making very useful and relevant design on even on medium and long term in terms of creation of very what do you call this, emergency ventilators which can be used, but of course takes a while before getting the approval of the Food and Drugs Administration. Next slide, please. The next frame, please. Now, let me, I am saying leadership to the university leadership and the committees. There were immediate action as a result of this lockdown. But as you can imagine, we continue to problematize also how the academic work of the higher education institution could be continuing. At the moment, classes have been halted, and we continue to meet regarding transition towards an online or a remote learning. And in the next week or so, we decided to come back. Some universities have stopped the semester, but in some cases, few universities, including my own, said that we can hold this, we can take this on, and we will proceed using remote learning. But let me also mention here that part of the challenges in higher education and some of the caveats, I would say, is that the COVID coronavirus is like a prism. Immediately, one can look at it as immediately a public health issue. But certainly, it is not only a public health issue. It is also a multi-dimensional problem and issue that will be here with us, very felt right now, strongly and feared. But in the medium and in the long term, we would still feel the implication of the coronavirus. And when I say it is a multi-dimensional issue, I refer to it as, in our case, it's heavily an academic issue. And it is connected with the fact that the Philippines ranked last out of the 15 countries surveyed within the region. And it is 100th out of 149 nations globally, which connection speed with a speed of 5.5 Mbps compared to the international standard of 7.2 Mbps. So as you can see, there is very problematic, weak internet connectivity. And this is based also on the report of the Akamai Technologies in 2017. It is also an academic issue. The COVID is an academic issue because the shift to open learning mode is a challenge for higher education in general. And given the lack of sound or very emphasis in the country, being a developing country, challenge any higher education institution. And at this point, it would be good to call on probably not just our government to invest into IT infrastructure and facilities, but also into the business and the development organizations to look into this. Also a challenge in the guarantee of measuring learning outcomes, even as we jump into remote learning, but we still have to work so hard to measure the learning outcomes and how well quality education is really achieved despite a very dramatic transition from face-to-face to remote learning and the interactive exchange between students and faculty. For one thing, it is not just about students being able to have access to IT and to the technology, but it is also themselves, some of the faculty who have to be held hand in terms of learning the technology. It is also, the COVID is an economic issue because for public higher education institution, the economic impact is manageable because of the existing policy of the Philippine government tuition fee for state universities and colleges. But the state universities and institutions and colleges are a minority. As you can see earlier, there's just about more than 100 of them compared to private institutions, higher education institution, which run in almost 2,000. And because of this, there is greater for private higher education institution to either close down due to operation if they do not meet the required resources set by the Commission on Higher Education. And the closure of businesses right now, especially micro, medium, small enterprises, can affect the earnings of the heads of families. And this can mean a setback, a big setback for the education of children and for the education of students. Next slide, please. Yeah.
Professor Ko, thank you so much for such an interesting presentation. Would you like to add some very last remarks, because we're running out of time, if I may?
Yeah, I think I deserve a little bit, 2 minutes or so, Alex. I'm the last and I'm the only woman in the team, so I think I will ask for probably negotiate for 3 more minutes. As I said, the COVID is a social issue as well. We have to be vigilant about fake news because of the flow of the free flow of social media, but at this time we have to transform into a new learning methodology that requires sensitivity for all, not just for the learners and the students, but also for staff, employees, and for the faculty and the stakeholders. The final issue here mentioned is that the connectivity issue, as I have mentioned. Towns in the Philippines across the country have different levels of internet connection, and this provides a big challenge. And lastly, even if students can afford to have some access to smartphones, the cost of the data might be very, very costly for some students. Finally, I'd like to come to, I think this is my last slide and frame. Overall, the key takeaway for this particular case is that lockdown, if there is a positive thing about this, the lockdown brings stillness to what is supposed to be a very busy world for us. So it's an occasion for Philippine higher education to rethink and to reinvent education. When I say reinvent education, to make it inclusive of everybody. And rather than competition, probably the lesson here is to have cooperation, not just among stakeholder institutions. We have to reboot education and the ways of learning. When I say reboot, it is not just online and synchronous learning, but it's also a synchronous mode of learning, a compassionate, conversational, inclusive learning. And finally, the last slide, connectivity is challenged by our upgrade to technology, but a technology that cannot be alienating and cannot divide people. It should be connecting people even more. We are positive that higher education in the Philippines will reemerge and flourish to become more innovative, as mentioned by earlier speaker, to be crisis ready. And the only way to go really is to have everyone pitching in for a better higher education by co-creation so that no one is left behind. Very much, Alex, and sorry for the extension of time.
No, always very interesting, Professor Ko. I thank you for that holistic view and especially for sharing in detail what is happening in the educational sector in the Philippines and particularly at the famous and very big University of the Philippines. Let me use the few minutes that we have now to address some of the questions, very interesting questions that we have been receiving from the participants from all over Europe and Asia Pacific. And I would like to invite the panelists to read, you hit on Q&A at the bottom of the screen, and please read them. Read the several questions that we have, and tell me if you would like to address a particular one. I'll give you some time addressing the first one that has popped up frequently. Of course, with some very nice comments on how people have welcomed this webinar and appreciated this deliberation. So there are two reactions very much valid and relevant. One, which is that in developing nations, I come from Latin America myself. I'm from Ecuador. And I relate very much with what I'm going to say through these questions that we have received. In some developing nations, the capabilities, the IT, the ICTs, the information communication technologies, the capabilities that universities or even schools will have are not ideal. We understand that. So all of these things that we debate here and the examples that you have heard from these universities and so on, sometimes are simply not possible because that will require a big investment and it takes time. And this is an urgent reaction because schools are closed, universities are closed, and we actually need to remain connected to the students, right? So several of those questions with that factor in common lead me to share with you an example that I heard, I think it was Bolivia, if not Colombia, or maybe both, very recently, I think last week, with something that I have in my hand, right? If you're looking at the camera. This is a powerful tool, a cell phone, and hopefully a smartphone. And yes, not all the families will have one, but or the kids will have one. But most of the times, even in poor rural areas, you do have one cell phone per family. I did read that one teacher had taken this, the extra mile, and had taken the time to call, this is a high school teacher, call all of the parents of, I think, 60-some students, all of them or the vast majority, or visited some as far as possible and keeping social distance, just to say, please join this conference call, which doesn't have much any cost actually in most countries, and it's easy to organize at this particular time, and make my students listen to my class just once a day. And I found that impressive because that shows the typical sense of duty and commitment that educators will have because this is a vocation. There is a great sense of mission, very similar to the one that we have at the United Nations. We staff members, we go above and beyond what we are supposed to do in exchange of a salary. We believe in what we do. And academia is exactly the same, if not even more, right? So there you have an example of what you can do when there is no technology available or no investments available even in rural and poor areas. The other comment that we have received very much, and this pertains more to our colleagues at UNESCO in Paris. As you understand, the United Nations is an amalgamation of several funds, program agencies, and so on, coordinated by our Secretary General and the Secretariat in New York, where the headquarters of our organization is. The European headquarters, of course, be here in Geneva. But many people have also mentioned how can we ensure that there is this global coordination. If there is, for instance, one of the questions say, is there one mandatory program, curriculum, standard for what high school should be doing, university should be doing, and so on? And I will tell you this, the United Nations, it's a norm-setting body. It's a multilateral, multi-governmental institution, but we do not carry the authority, and we are not supposed to have it. Every member state, every country, it's sovereign and independent, of course, and every government decides what to do. But we can indeed help with the recommendations of public policy, recommendations on actual standards, programs, regulations, guidelines, and so on that UNESCO actually has. So I can point to UNESCO's website, and you will see this is Global Commons. Very many information, relevant information that you can use in whatever country you are to see what would be the ideal, depending on the situation and relative development of a particular country. But there is no such a thing as saying this is the mandatory curriculum. We have tried in the past, There is some coordination. Europe is a good example of that, but there is no one global recipe that fits all. However, very much relevant best practices and recommendations at UNESCO and other UN entities that I invite you to read. And with that, in the few minutes that we have, I wanted to invite any of the speakers perhaps to very, very shortly, 60 seconds, perhaps to address some of the questions that we have received, if you would like to comment on something. Who would like to go first? Yes, Professor Sachs, go ahead, please. Yeah, and you are muted, by the way. Please unmute yourself. You are still muted, Mike.
Okay,
yeah.
I've been listening assiduously, Alex, to your very astute comments about the overall interplay of the speakers. But I have also been reading some of the comments and questions online as well. And I think one issue that really comes to the forefront of my mind is the question of global governance, which someone's raised, Saad Medhat, because I think that one of the issues from my perch is that I think universities are obviously doing slightly different things in terms of responding to the crisis. However, I think that we do need to learn from each other, and we do need to look at the issue that you raised about the possibility of more global coordination. This is a bit more than actually sharing best practice. It's actually whether or not we need to look at stronger national systems for providing a template for universities and colleges, you know, to work together, but also whether or not there is a case for more global parameters in terms of how we deal with this, because the more virtual we become, the more online learning we have, the more global we're going to become in terms of scope. And I think that there is certainly a lot of mileage across both developed and developing countries to look at a more coordinated approach. And that's one thing that's very much come out of this session for me, that we do need to think about more global coordination of governments. And I think UNITAR and the United Nations generally provide a tremendous platform for doing this.
Indeed. Thank you so much, Professor Cole. Before we go to the next speaker, if you want to address some of the questions or share some final comments, let me also tell you, indeed, that this crisis has some positive outcomes. It will teach us, and is teaching us very interesting things on global coordination. Multilateralism is not dead, as you have heard. It started more than 100 years ago, but it's very much alive and kicking. And multilateralism, in this particular case, will allow us to increase global coordinations on issues on public health, but also on global education, indeed. And we are learning from each other of these new realities. However, there are very many challenges that we are facing at the moment. One of them, I have also been monitoring the questions, and there is a very particular question addressed to me, and I would like to briefly address it, which is how can universities refund, return, or stop charging tuition fees, and at the same time pay teachers? Very, very relevant question. There are very different business models for universities, as you will understand. In the case of fiscally supported, centrally supported, government supported universities, as two of the ones here, and Professor Ko addressed this, is relatively easier to stop requiring tuition fee payments from the students. But in the private scheme of educations, in which not state-funded universities need to pay salaries to administrators and faculty members based on the income that they receive from the tuition fees, that is a more difficult scenario. And I simply wanted to say that in the Brookings Institution suggestion, that was proposed as an alternative with all these social dimension benefits for a limited number of months. Indeed, it's not possible to do this for a long, protracted pandemic. And the next step will be that the government indeed also provide funding for salaries for those academicians and administrators in private sector educational institutions. So it all goes back to the government because if not, it's not sustainable, but it is a matter of social responsibility for universities to do their utmost, as most of them are doing, to maintain employment. I go back to the panelists to see if there is some final comments or if you would like to address any question. Yes, Professor Catani, you need to unmute yourself first.
Right.
Yes, go ahead.
Okay. My brain goes to developing countries, of course, and the problem raised there. There are technical problems like the lack of facilities, the lack of lines and sufficient supporting systems. What can we imagine to do to boost the education in developing countries in this particular time? There is not only a problem of technique, there is also a problem of the real teaching. If you go, for example, in entrepreneurship, the physical presence of a teacher seems to me difficult to replace with online work. So developing countries is very much on my area. The second point is that, okay, for distance learning, okay, for all these new techniques, but how do you solve the problems of laboratory work, especially in some universities that are with arts and with movies, with all these other issues? I'm thinking still laboratory for physics and for mechanical engineers. This cannot be replaced by simple distance learning. So we got to think how we can manage that portion, that part.
Indeed, Professor Catani, very relevant, and I'll tell you, my wife and I have 3 daughters. One of them studies medicine, no less, at King's College London. Of course, there are no classes and no practices. How can you become a doctor? We had this conversation with her twice. If you only have the academic component for several months ahead, and you're missing the hospital rounds, you're missing the actual practice in people, because that's how doctors actually do the practicum, as they call it. It's very, very complicated. You can somehow with telemedicine, you can somehow with all these videos and all these simulations, even with 3D and gamification and virtual reality, but it's not the same. So it's a new paradigm, and universities are at the forefront of understanding how we as humanity as a whole will perform under that paradigm. One last comment or question before we close. Our time is over, but this is very interesting. It's quite a privilege to get to hear to all of you. Any last comment from the panelists? Yes, Ambassador Sul. You need to unmute yourself. Ambassador Sul, yeah, go ahead.
Yes. Actually, I have a question regarding the medical response to the this infectious disease. I mean, if you look at the chart of the outbreak and infection of the COVID-19, somehow there were different responses from countries. And one of the issue was wearing mask. And if you look at if you remember the initial stage of WHO directives, they were strongly recommending to wear masks. But as you see, many countries, particularly in the East and in the West, they have a different attitude regarding wearing masks. So I was wondering, I mean, if we are about to address this issue, I mean, this spread of infectious disease, somehow we have to have a common understanding about the, how do I say, health measures to counter this spread of the COVID-19 in any infectious disease. Can you give some ideas about this issue? Why people are responding differently regarding the use of masks?
Thank you, Ambassador Sul. Quite interesting and a topic in itself. But I have also been monitoring that very differentiated response. Even the American government, the US government, with this humongous crisis in their hands, had to backtrack after they say no mask is needed, now to say, yes, you need a mask. And this is the prestigious CDC, the Centers for Disease Control, which is a global reputed institution. So very interesting comment. May I invite Professor Sachs, because I know that he has a lot of expertise on issues of public health, just to give a short comment on this, and then indeed we will address these issues on the weekly webinar that UNITAR organizes every Thursday. We have one, in some weeks we have two, and so on. But Professor Sachs, some final comments on this issue.
Yes, I think what's interesting is that it may appear just to be a technical issue, like are masks effective or are they not effective? I think this is a highly politicized issue. We've had a major problem in the NHS in the UK with providing personal protective equipment, including masks. And I think that one of the questions here is whether or not the government haven't pushed the wearing of masks, because there is a complete shortage of this particular item of equipment, even for people at the front line. And so I do think that we mustn't take politics out of the equation, that we do need scientists to actually investigate the pros and cons of different ways of protecting ourselves within the university and college sector against coronavirus. But I think there's much more than that. There are other dimensions in which we need to be involved. And one of the things that I think that we perhaps haven't emphasized enough is the importance in decision-making in universities and colleges in terms of how we respond to the coronavirus crisis, the need to actually engage with students, with staff, as responsible leaders, and to set up dialogues about how we best proceed and what further action can be taken, because we do need to be inclusive, we need to respect diversity, and we need to move forward in a common and consensual way if we're going to deal with this within the higher education sector.
Thank you very much, Professor Sachs. Thank you, Ambassador Sul. And with that, I am going to close this webinar. You have seen the answers to the polls. And I would like to close this webinar paraphrasing one of the comments from the participants. We had close to 500 registrants and 267 people that actually participated in these proceedings. But then even Esther Veloy wrote something that I would like you to hear. It says, "Thank you very much for this webinar. I learned a lot. Congratulations to UNITAR and to all the speakers. And this is the important part. Together we can beat COVID and heal our nations as one, capital one." And that's a beautiful comment. I thank you, Vanessa, and all of you, the panelists, for this team effort, indeed, to somehow bring some light on what is happening in the higher education sector. With that, on behalf of the United Nations organizations and UNITAR proper and the CIFA Global Network, I thank everyone for participating. I wish you a good day ahead, wherever you are around the world, and most importantly, stay healthy. Blessings to all. Thank you and goodbye.